The CDC has decided that we can use Johnson & Johnson, resuming following those concerns about the rare blood clots developing in some women.
And Dr. Mark Seidner, an epidemiologist at Mass General Hospital, joins us now to answer some questions. Doctor, thank you so much for joining us this morning. Experts say that the benefit of the single-shot vaccine outweighs the risk here. So what is the real risk? And people are wondering, are there any pre-existing conditions that could raise it?
Sure. Whenever we talk about risk, we also have to think about benefits, about trade-offs. And right now, it looks like the population being affected is young women. And in them, these side effects have been occurring in about 1 in every 150,000 women. Now, the flip side of that is that in, for example, 40 to 50-year-olds who get COVID, death occurs in about 1 in every 1,000 people. So if you're sitting on an airplane with a parachute and I'm about to give you one, I say this one fails every 1,000 times, this one fails every 150,000 times. You take the second one every time. So it still looks like the benefits far outweigh the risk, and that's in young women. There have been no clots in men, and exceedingly rare, less than 1 in every million women above 50. In terms of the pre-existing conditions, there's been so few cases of these, it's difficult to know, but they're especially thinking about young women. They're thinking about hypertension and potentially obesity as the risk factors for this condition.
Okay, so being that it's a single dose, of course, people get protected faster. Is there any reason someone should actually look for the 2-shot Pfizer or Moderna over Johnson & Johnson, or do you still just take what you get?
Well, as you mentioned, this J&J vaccine comes with many benefits, and I think the most important one is the 1-shot regimen. This means it can help us get to places that are hard to get, people who are immobile, people who are marginally housed, people who are frankly too busy from work and childcare to get to 2 different shots. So I think it's going to continue to be a very important part of our response. And frankly, I'm glad to see this pause took place because it showed us that the system's working, that the scientists can evaluate the data, and that we can make sure that these are safe and effective as they are.
The Johnson & Johnson vaccine has been off limits for almost 2 weeks now. How do you think that could impact reaching herd immunity in the U.S.?
Our government purchased millions of doses of all of these vaccines, and even enough to vaccinate everyone in the United States, even by the summer, even if we only have 2 of 3 vaccines available. So I think we're in actually very good shape, even with 2 vaccines, but with a third back on the market, I think we'll be fine. And again, I think this small pause, even though it may delay things slightly, it was necessary to make sure these are safe and effective to be used.
Well, timing's everything. A lot of families are now returning from out-of-state travel. School vacation week coming to an end. Some schools are requiring that negative PCR test before kids can return to in-person learning. Is that all parents should get, or should they consider a couple days of quarantine as well?
Yeah, well, with COVID-19, I think nothing is universal, and certainly no one size fits all. So, for example, if your family was camping in Vermont and the only thing you saw was some wildlife, I think you should feel pretty comfortable coming home, maybe getting a negative test and getting back into school. If you were dining maskless in Florida, for example, you just need to remember that it can take 7 to 10 days for these infections to develop. So that's a situation where maybe a little bit more of a prolonged quarantine and additional testing would probably be warranted.
Very good insight. All right, Dr. Mark Seidner, an epidemiologist at Mass General Hospital, thank you so much for joining us this morning.
Thank you.